A new Wordle puzzle is online. Click on the link to play.
Listening to the following video may give you clues. Please like and share the videos.
Hepatitis outbreak in children. What to know. In case your child is infected by hepatitis, there are some things that you should know.
These include the symptoms, treatment, and prevention. If you think your child is at risk, you should seek medical care as soon as possible.
Fortunately, there are several ways you can prevent the spread of the disease. Read on to learn more.
The following article will provide you with some important information. Signs and symptoms of hepatitis in children.
The signs and symptoms of hepatitis are usually similar, but there are some differences. The symptoms of hepatitis are different from those of adenovirus, the most common cause of mysterious childhood illnesses.
Adenovirus is not a serious affliction, but it can cause fever, joint pain, loss of appetite, nausea, and vomiting. These symptoms are similar to those of adenovirus, but a physician can distinguish the two.
In most cases, children with mild cases of hepatitis develop the illness following a viral infection. However, in some cases, liver failure occurs.
Some children in the UK even required liver transplants.
In the UK, most of the children who contracted hepatitis also tested positive for an adenovirus, which is a common cause of respiratory illness. However, it is not entirely clear why adenovirus is causing an outbreak of hepatitis in young children.
According to the World Health Organization, nearly 200 children have been diagnosed with hepatitis, resulting in 17 liver transplants and 1 death. Most cases have been reported in the United Kingdom, but the outbreak has spread to at least 12 other countries.
A U.S. outbreak has been reported in some states, including Georgia and South Carolina.
This disease can occur in children as young as 1 month and as old as 16. In some cases, children with hepatitis are not able to process medications or supplements well, so their pediatrician may want to modify the dose or stop the medication until the child is able to tolerate the injections.
Children with hepatitis A should practice good hygiene, especially when changing a diaper or using the bathroom. Proper personal hygiene is crucial in keeping the virus from spreading throughout the school.
In addition to the above symptoms, children who are immunocompromised may also develop hepatitis. This condition is often accompanied by common cold viruses.
Although adenovirus is commonly associated with common colds, it has been linked to the outbreak of hepatitis. Vaccination with COVID-19 has not been associated with the outbreak.
So, the outbreak is still under investigation as the cause of the outbreak is not yet known. The symptoms of hepatitis outbreak in kids are not a given.
However, a high liver enzyme level is a sign of hepatitis. However, if hepatitis is suspected, medical experts are scrambling to identify the cause.
A strain of adenovirus of type 41 has been detected. The WHO has issued guidance to countries affected by the outbreak.
Hepatitis is a viral infection that infects the liver. It can be mild or severe and may lead to liver failure or even a liver transplant.
While medical experts are unsure of the cause of this outbreak, they do know that it is caused by several contagious viruses. The virus variants involved in this outbreak are not yet known.
The symptoms of hepatitis outbreak in children should not be ignored. Treatment.
The Centers for Disease Control and Prevention (CDC) recently issued a public health alert about a possible outbreak of adenovirus-associated hepatitis in children. While most cases of hepatitis are mild, some children have required liver transplants or specialist care.
The virus that causes the outbreak is common among adenoviruses, which are spread from person to person. The virus causes outbreaks of hepatitis B or hepatitis C in children.
This outbreak is particularly troubling because at least 1 child has died and an estimated 10 of children are required to receive liver transplants. In fact, according to
data, more children will need an urgent liver transplant in the next decade than over the past 10 years combined. So, what should you do?
The first step in the prevention of hepatitis is to limit exposure to other germs and viruses. The recent COVID-19 pandemic has reduced the circulation of other viruses and adenovirus, but there was no correlation between vaccination against the virus and severe hepatitis outbreaks.
Therefore, you should avoid exposing your child to other people and germs. If you have young children, you should consider seeing a pediatrician and have them check for symptoms of hepatitis.
There are many possible symptoms of hepatitis. The symptoms of hepatitis B or C may include fatigue, fever, abdominal pain, or other symptoms.
The most common symptoms of hepatitis A are fatigue and nausea, and the condition usually clears up within 2 months. Symptoms are usually absent in children younger than 6 years of age.
However, the symptoms may be different from those reported during the current outbreak. Some of the symptoms of hepatitis include yellow skin, fever, abdominal pain, and diarrhea.
In addition, many of the children with the disease also experienced gastrointestinal problems, such as abdominal pain, diarrhea, and vomiting. Some cases did not have fever, but most experienced these symptoms.
Other symptoms of hepatitis include joint pain, fatigue, dark urine, and a lack of appetite. The CDC is monitoring the current outbreak of hepatitis B in children.
Adenoviruses have been associated with the recent outbreak in children, but no one is quite sure why. Experts are still studying the connection between the outbreak and the COVID-19 vaccine.
The COVID-19 vaccine is unlikely to be the culprit. Hepatitis outbreaks are fairly common in the United States.
More than 40,000 cases have been reported since 2016. Symptoms of hepatitis A usually begin 2 to 6 weeks after exposure to hepatitis A.
Symptoms are mild and may go unnoticed for weeks or months. If symptoms persist, visit your doctor.
Symptoms of hepatitis A are similar to those of many other illnesses and can vary from child to child. However, in some cases, the symptoms of hepatitis are not as obvious as those of other diseases.
Prevention. A recent hepatitis outbreak in children has been accompanied by a national health alert.
The World Health Organization has reported nearly 200 confirmed cases of the disease with 1 death and 17 liver transplants. The majority of cases were found in the United Kingdom, but the disease has now spread to 12 other countries.
Children in the UK have also been diagnosed, with ages ranging from 1 month to 16 years.
The virus is highly contagious and spreads via contaminated objects, sexual intercourse, and injection drug use. Children should wash their hands regularly and thoroughly, with soap and water, especially before and after touching food.
Toilets should be cleaned daily using a household disinfectant with bleach. Using rubber gloves is helpful in protecting the hands.
Lastly, it is important to flush urine down the toilet. If the child has been exposed to a case of hepatitis, he or she should be vaccinated.
The WHO's Global Hepatitis Information Center has updated the hepatitis surveillance system. The virus has been found in children in Ireland, Spain, and the UK.
The Centers for Disease Control and Prevention has issued a Health Alert Network health advisory to inform healthcare providers of a cluster of child hepatitis cases in Alabama. This outbreak is linked to an increase in the transmission of adenovirus in the UK.
Symptoms of hepatitis are similar to those of a common cold virus. The virus is typically caused by the same type of bacteria that causes a cold.
Adenovirus type 41 is one suspect. It causes diarrhea, fever, and vomiting, and may be accompanied by other symptoms, such as a respiratory infection or a rash.
Children who contracted the outbreak may be more vulnerable to a severe form of the disease, which requires immediate treatment to infection with hepatitis. It can be prevented by a simple, yet effective, vaccination.
During childhood, children aged 2 to 18 months should be vaccinated with a hepatitis vaccine. The U.S.
Centers for Disease Control and Prevention recommend that infants receive this vaccination, although some cases have relapsed. A vaccine can help prevent hepatitis and other hepatitis infections.
Hepatitis vaccine was added to the recommended childhood immunization schedule in January 2006. It is administered twice, with the first dose given at 1 year and the second dose at 2 months.
The vaccine is effective against both adenovirus and COVID, but children are more vulnerable to hepatitis. A vaccine is recommended for all children between 2 and 18 years of age.